Good morning. I'm Stephen Williams, the Director of the Houston Health Department. I want to welcome you to our COVID-19 talk with our local health department, health authorities, that is. With me from the City of Houston is Dr. David Persse. With me from Harris County is Dr. Umair Shah. I want to give thanks for the Rotary Club of Houston and Kathy Finninger, who is sponsoring our COVID talk with these local health authorities. Well, thank y'all for participating in the rapid fire last week, but we're not going to start off that way this week, okay? The first question, we're receiving mixed messages. Are cases up or down?
I'd say cases are rather stagnant. We're getting about the same number of cases, give or take 10 to 15 per day. Now you got to keep in mind that we still have this problem with the lag in reporting from the labs, and so if we get a spike, you can't look at a one-day spike, you got to look at the trend. So right now we're actually fairly flat, I would say. I'm calling it a plateau.
Yeah, I would say the same thing. Maybe the confusion is that there have been reports that outside of this community, this region, that there have been some increases across Texas. And that trend of some, again, I don't know how much of a trend it is, but you've seen a few days of that in other communities. I know that Dallas had some increases, so there may be some confusion, but here locally, I agree with David.
Is there something you can attribute that increase in other communities to?
The increase in the other communities?
Yeah.
Well, no. I don't know exactly what's going on there. The physics, if you will, of the virus are no different here than in any other community. So.
Yeah, and I would just say, we've done a phenomenal job as a region here to really fight this virus, specifically here in this community. But I would say that reminds us that we're not out of the woods, and that what you may be seeing in other parts of Texas, we can't have the arrogance to think that it can't happen here, that we could see an increase here, especially as people are mixing together, things are reopening. And I think the big message is that if they're not social distancing and doing all the things like facial coverings and hand hygiene and making sure they're not out when they're sick, those kinds of things, that the concern is it could happen here too.
Can I say, I don't want to put words in your mouth, but when you say we, I think you mean a collective we. I don't think you mean the three of us. I think you mean people who live in Houston, Harris County, and Southeast Texas, really, that they have responded to the message.
That's right.
And that's where the rubber meets the road.
No, you're right. This is about government and all the things that we are doing and response partners, but this is about the entirety of the community, everybody coming together. And really, because we can enact things, but ultimately it's only when people are following that advice. Like if we said, look, you can't be out in public to do something, but people were in their residence and they were bringing their friends over and they had 20, 30, 40 people together and having parties, and you're not going to be able to do much there. And so this is really about our community. You're right, David. Thanks for that. Yeah.
So we've opened up, or started to open up in the last week. Give me your response or reactions to that.
So, just this morning I was looking at a report from the University of Texas, which I think I shared with you, and I don't know if I shared with you or not, but I will make sure that I do. And it's a team from the University of Texas. They did a report on the Austin area, and they did a report on the Houston area. It's preliminary. But what they said was they are projecting, and this goes along the Kinder Institute report, that thinks that because the Houston Harris County acted early, that we have reduced the transmission since, I can't remember the exact date, but in early March, the potential transmission has been reduced by somewhere in the neighborhood of 90 to 95%. So that's good news. Now we got the Kinder Institute, and we've also got the study from UT basically saying the same thing. So to your question, as we open up, if that means people start reverting back to previous behaviors, all of that ground could be lost. So, I've been saying we need to stop thinking about going back to the way things were. We need to move forward to what the new normal is going to be. And we get the opportunity now to define that. But let's move that way and not lose all the gain that has been made.
Yeah, and the only addition is the backward piece, is we just don't want to go backward in seeing an increase in cases. And then, unfortunately, all the reasons that we did this was because we wanted to protect the healthcare system so we didn't have an overwhelming surge. We certainly don't want to see an increase in that healthcare system.
Infants to older teens have developing mysterious symptoms such as reddening tongues and enlarged coronary arteries that are thought to be COVID-19 related. Your thoughts? Any cases in our area?
Yeah. You heard about this? I was just reading about it the other night.
Go ahead. Yeah.
It appears to be, I've only read one report on it, so I'm clearly not an expert, but there is some early reports coming out of Europe and some in the United States of kids developing a Kawasaki syndrome type phenomenon, which they have not been able to directly link it to previous COVID infections, because a lot of the young folks, they're not being tested because they're not having symptoms, and they may have been infected. Some of them may have been tested. So the link in the article I read has not been direct, but there's a lot of suspicion that this may be a really late complication. So we've got to keep an eye on it. This is potentially very serious, but I think it's too early to say it's a cause and effect relationship at this point, but something we do need to keep an eye on. And let's say, this virus has broken every rule, right? And so it wouldn't surprise me if we find something.
Yeah, that's why we don't want to lose emphasis on the younger population. I mean, everybody's been focusing, including us, on seniors and those with underlying medical conditions, but we also want to make sure people are thinking about children and adolescents and younger adults.
Please comment on plastic shields that I've seen on some store workers. Aren't these to protect against liquids or not airborne?
David,
shields.
That sounds, I mean, yeah, I haven't seen plastic shields on
the
workers like
workers?
that.
No, they're actually plastic shields in front of cashiers.
Oh, yeah.
Y'all need to get out a little bit more often.
Yeah. It's been a little busy.
So y'all don't go to Home Depot like that.
Yeah. Well, no, yeah,
I've seen that.
Yeah, okay. I thought you were saying plastic shields on somebody's face. So if they're those are acting as barriers. That what you're trying to do is just to separate individuals. And you've even seen some really touching commercials on TV where we've had seniors, like a senior on one side of a glass of a door, and on the other side there's the family member, and they want a barrier between each other. It's a very similar concept. Yeah.
I think that it's like the what do you call them? The sneeze guards, right? So that would be good for the large droplets, but not necessarily the small droplets.
Right.
So I guess my point is, it doesn't mean people shouldn't wear a mask in addition to that. That doesn't replace a mask.
Or social distancing by 6 feet. Yep.
Right.
Okay, thank you for watching our COVID-19 talk. We'll be right back in a couple of minutes.
Talk amongst yourself.
What is the 2020 census? Every 10 years, the census records everyone living in this country. It's written in the Constitution and comes in a questionnaire that counts everyone who lives at your address on April 1st. The data can be used to inform funding for services like fire stations, schools, clinics, and representation that affect your community. Shape your future. Start here. Visit 2020census.gov. It's a short ride from your neighborhood to your naturehood. Find fun activities to do, like boating and biking, or camping and hiking, plus much more. To find a neighborhood park or green space near you, visit discovertheforest.org.
Welcome back to our COVID-19 talk with local health authorities. We have a Facebook post from Jacqueline Foreman. Please continue practicing social distancing and masking up. I think that's one of the things that y'all wanted to say. Gene therapy, what about it? What's the relevance of it?
Yeah.
Well,
I don't know with this at this point.
Well, I think there's been just some quick reports about gene therapy maybe being used for vaccine development. But outside of that, I don't know more that it's being used in any other therapeutics outside of just vaccine development. I think the thought being that as we can we can study the human genome, the DNA, and all the other stuff, and then you can take some of that, look at some frailties of that genome as it relates to the actual virus and what it might be attacking, and try to design a vaccine against the virus and what the vulnerability that it's attacking in the human genome. So, again, I'm with you. Not as much of information on this one, but that's all I know. Yeah.
A little bit different question. It's more political. Leroy Brown comments, growing public is becoming distressed over this government overreach of our freedoms and liberties. You're health authorities. What is your role?
Yeah, so our role really is disease containment, disease control and containment, to try to control the disease. And a lot of and this is a great question, because a lot of our public health laws were written early in the century, in the 20th century, when diseases like measles and so on and so forth were rampant. And I remember now, I went to school with a kid who had polio. I remember his name, I won't mention his name, but he had polio. Well, we don't see polio anymore. And I remember my grandparents, when I was a little boy, my grandmother lived with us, and I remember the attitude of my grandparents and my parents in the neighborhood was that, all the adults were like parents to all the kids. And when it came to illness, now I got measles, and I got pictures of me at 2 different ages where I got red spots all over me. I was too little, I don't remember what I got, but I got 2 types of illnesses that both look like measles to me, but I'm clearly about 2 years apart in these pictures. So I don't know what I got, but I got both of them, right? And so the attitude then was different when we talk about individual rights and protecting the public. The attitude was different. And so I think today we live in a society, and I guess I'm going to get a little political, we get in a society where we are so focused on my rights and individual rights to the expense of others, potentially to the expense of others, because we live in a world where there's so little risk. Whereas back when I was a boy, I'm 60 years old, but that wasn't ancient history, where the world recognized that, listen, what is important for all the kids and everyone in the community outweighed, at that point, the needs of any one individual. So it's a huge shift in society. And my fear is that we're going to wind up paying the price for that, whether it be with this virus or another illness coming down the road. But that's why the public health laws are written the way they are, is to protect the public from the spread and the devastating consequences. Again, I went to school with a kid with polio. He had lots of problems, and it was preventable.
Yeah, we say oftentimes public health is inherently political, and we know that. Our jobs, the 3 of us, our jobs are to give the public health recommendations, and we know that there's a political lens to that, but our job is to stay in the science and the public health evidence. And Texas law does require that communities have health authorities, otherwise it goes back to the state. And so that's what the 2 of us are, the public health authorities, and our job is to protect the community from those infectious diseases. But the one thing that I always use is the analogy of seatbelts and drunk driving. So in seatbelts, you're really required to wear the seatbelt, and we have different fines for somebody who doesn't wear a seatbelt, because it's to protect you from going through the car window, the front windshield. But in a drunk driving situation, it's markedly more than just a fine. We do jail time, we do all sorts of things, because you're actually protecting the other person. And that's where I think we are, is really struck with what is something that you're protecting the individual versus actually protecting the community.
Which vaccine projects are underway appear to be more promising?
I don't know. I don't have an answer to that.
Yeah,
there are several.
Yeah. Actually, there's one with Baylor College of Medicine with Dr. Peter Hotez, who has been our community representation in the global world. He's done a fantastic job. He David and I talked to him a lot. He's been just amazing. But Baylor College of Medicine, University of Texas Medical Branch Galveston, UTMB is also developing vaccine. I think the real issue is that there's a lot of talk about vaccine being available quickly. And Dr. Fauci on Friday evening was interviewed, and he said, look, at best it's going to be January. But last time I checked, that's still 6-7 months away, right? So we're still talking about a long period of time. But the vaccine development is one of those where we're really concerned that if everything goes well, it'll be January, but it may be much markedly longer.
I think it's important we do a little bit of setting expectations.
Yeah.
Right, because the first vaccine that comes out it will have X% effectiveness, right? And hopefully it has no complications, right? No side effects, but it'll have X% effect. And then as time goes on, we may, 2 years from now, we may have a much more effective vaccine, and that would surprise me. But I think we live in a world where today the vaccines we get are highly effective with really low problem profiles. That's right. Because they went through a very exhaustive development process. We're rushing this now. So we need to be realistic with our expectations.
Yeah.
And I'm reading these questions. What are viral vectors?
What are viral vectors?
Yeah.
Well, for this virus, people are the viral vectors. Okay. So the vector is generally defined as a living being that can transmit an illness from one person or from one entity to another. Mm-hmm. So, like mosquitoes, for example, are a vector. Mm-hmm.
That's right.
Yeah.
This next one's a pretty interesting question because I think everybody is thinking about this, given the fact that we are, in fact, reopening. At what level of increase in cases would you recommend closing business? Or would it be just an increase of cases, or are there other markers for maybe?
Yeah, I don't know if I have a percentage right now, and David, if you do, I think from our standpoint, this is where I've talked a lot of times that it's the science of medicine, the art of medicine, it's the science of public health, and it's also the art of public health. So it's not just a number, but it's actually probably a combination of factors, which includes the number of cases in the community, which we've talked about is the amount of transmission, but also what's happening in the healthcare system, the hospital surge, and how overwhelmed the healthcare system is becoming, or that we're thinking it's becoming. Those are the kinds of things that I would factor in.
Yeah, and this question really leads to a very complicated ethical aspect of this. So we have talked from the beginning that one of our goals, and one which we have successfully achieved through our partners in the healthcare industry, is to make it so if somebody became sick with COVID disease and they needed a hospital bed, that there would be a hospital bed available for them. So we have clearly successfully achieved that. But as we move forward, we run the risk, because history has shown, and we're starting to see it elsewhere, is that when you get this rebound, the second wave, it's something that comes on very fast and very, very steep, and where we could overwhelm. And so one of the conundrums is that today we are below the threshold of what a hospital needs. There are about, within Harris County, there are about 200 patients that are hospitalized in ICUs with COVID disease. All right, those people are very sick. Now, so far it looks like most of our current numbers suggest that most of them are going to survive, but they are very, very sick. And some of them are in the ICU for 2 weeks at a time. And we can't forget that that's not acceptable. We shouldn't be happy with that. That is still not acceptable. So as we move forward, you say, at what point do we want to flip things back? Well, are we looking to just save lives? Are we looking to keep people? Are we just looking to make sure there's a hospital bed available? So if you're sick enough, there'll be a bed available for you. I don't know that that's the goal we want. I think we want people not in the ICU. I think we want people not to die from this.
Yeah.
So will using hand sanitizer every day make stronger bacteria?
Well, hand sanitizer what?
Using hand sanitizer every day may create stronger bacteria. That's a question, actually.
It's an interesting question. You know, we do talk a little bit about the bubble, that sometimes there have been some theories that if we over sanitize, we Lysol everything and we do too much of this and all this other stuff, that actually what happens is especially our kids, they don't get exposed to the natural immune system response that would happen to bacteria and fungi and viruses, et cetera. And so we do want to be careful with that, but right now we're in no place with that. Right now we're trying to do everything we can to fight this virus.
Okay, thank you for joining our COVID-19 talk with our local health authorities. We'll be right back in a few minutes.
Respond to the upcoming 2020 Census Survey online, by phone, or by mail. A complete count of all Houstonians helps our city secure federal dollars for roads, schools, healthcare, housing, and disaster recovery. By answering just 9 questions, your voice will help shape how Houston is represented by state and federal officials over the next 10 years. The census is easy and everyone counts. Your responses are safe and confidential. For more information, please visit 2020census.gov.
With coronavirus spreading, people at higher risk must take extra precautions. You're at higher risk if you're over 65 or if you have an underlying medical condition. Please visit coronavirus.gov for more information.
Wash hands now. Wash hands now. Wash hands now. Hand washing is one of the best ways to stay healthy all year long.
My grandma always says everyone counts, and everyone who lives with us is special. Like my aunt, who took me on my first bus ride to the library, or my older cousin, who walked me to my first day of school, even my mom's friend and her baby who live with us.
The census informs funding for schools, roads, healthcare, and more. So count everyone in your home, including all children on the 2020 census. It's your chance to help them for the next 10 years. You can respond online, by phone, or by mail. Shape your future. Start here. Learn more at 2020 Census.
Welcome back to our COVID-19 Talk with Local Health Authorities, sponsored by the Rotary Club of Houston. When we went to the break, y'all had another discussion regarding this bacteria and hand sanitizer, and David, I think you wanted to expound on that.
Yeah, I think that the question goes to the issue of bacterial resistance that has developed from the overuse of antibiotics, and that's a consequence of random genetic development within the bacteria, that those that happen to have a resistance to whatever bacteria, they are the ones that then grow, right? So this is a Darwinian gene selection sort of thing. When we talk about hand sanitizers and stuff, that's a completely different thing. So is it possible? Anything is possible in biology, but could a bacteria or a virus develop an ability to survive Clorox? Probably, possibly, but it's a completely different thing from the antibiotic overuse and resistance that's developed.
Agree.
This is a related question. If you're washing your hands so much they develop cracks, could you become more susceptible to the infection? It's kind of related to the other question.
So I don't know that this virus, and Umair, you chime in, I don't know if this virus infects people through, hematologic spread through cracks, so getting into the skin. There are other illnesses, however, that do. So.
Yeah, it doesn't. That said, obviously we don't want to have too much. I mean, you don't want to have, usually people don't have big cuts and, that kind, we don't want to test it out, if you will. But generally, it does not. So it's really about the air droplets or touching surfaces. Now, I do think we still want to continue to make sure everybody emphasizes soap and water first, hand sanitizer is plan B.
Right. This is a question for me, too. Is it safe to go to a dentist for routine reasons?
Well, my wife is a dentist, so I guess
so I would defer to you. Yeah. What does your wife say?
That's an economic response, Umair.
Yeah, no, I mean, I would say that, and she's a great dentist, by the way. Just not,
She's the best one in your house.
She's the best one in my house. Dentists, I have to be honest, and our health department has been concerned about this too, and we've heard this across the country, that dentists have been sort of left out as a field because they have a lot of risk when it comes to drilling and doing all sorts of things inside somebody's mouth. And an individual going to a dentist is probably okay. It's the dental health professionals, including the dental hygienists, et cetera, who have to really make sure they have the personal protective equipment and all the strategies to protect themselves. I think that's the real key issue. But as far as whether you can go to the dentist, yes, you can. But we're also still saying go to a dentist if you really have an urgent or an emergent issue, and not just because you're going for aesthetics.
Yeah, and I think consulting with your dentist, they'll give you good ideas of whether or not you need to come in for that, whatever it is.
That's right. That's right.
Because they know what their situation is.
That's right.
Should doctors' visits include routine blood tests to determine who has had this infection? This gets into antibody testing, doesn't it?
Yeah. So we're not quite there. I got to give it to the FDA. They have stepped up their game. I was very frustrated with them early on, but they are moving towards assuring the accuracy of the serology tests. So they're not there yet, but they're moving in that direction. So I would say it's a little bit too early for that, but I'm hoping that within the next couple of months we'll have a clear answer on that.
And right now we're not recommending, from a public health standpoint, antibody testing from our department standpoint. That's still not something we're recommending.
Right, nor ours, right.
Yeah.
Some cruise lines are starting to signal a return to the seas. Under what circumstances would you book a cruise? And I want you to elaborate a little bit. So if I go on a cruise, or what would your advice to cruise lines be to maintain a level of safety?
To the cruise lines?
Yes.
They need to have very low occupancy on their boats. And then all of the things that, you know, the frequent cleaning of the commonly touched surfaces, their crew members, they, you know, well, if you want me to, I would have your crew members quarantined for 14 days before you took off on a cruise to make sure none of them are sick. I mean, it's, yeah, the cruise industry is a really difficult situation. I'm not going to take a cruise anytime soon, but if you want me to give them advice on how to do it, they've got a very high bar. And here's the thing is, the cruise, because you generally got a lot of people in a small area that are constantly coming up against each other, that's what makes the cruise a high-risk environment.
Okay, we have 2 minutes left, so I want you to be brief in your answers.
Is this rapid fire?
Not yet.
Okay,
I don't know
not
that
yet.
we're going to do that. It appears to be semantics, but the World Health Organization has recommended that physical distancing replace social distancing to explain the goal of keeping a physical distance while encouraging safe social connections. What mental health increases have you seen? Well, first, just comment on the first part, social distancing versus physical distancing.
Yeah, and I think the question really answers it, that it is semantics a bit, but I think it gets to a deeper piece where we are not trying to get people socially distanced in the psychological and emotional and spiritual way. We're just trying to get them physically distanced. So I do think that's important, and I think the other aspect of it that's important is the fact that there have been mental health consequences of a lot of these decisions across the globe. I mean, you know, even our kids, and I always think about the kids the most. I mean, they're coming up with seeing a pandemic, and they don't even understand why they're at home and all these other things. So I think physical distancing has significantly impacted mental health and social emotional well-being to a significant portion. Yeah.
What is the latest combination of drugs? It says you're recommending, but you're not recommending specifically any combination of drugs as the local health department. And it lists a number of drugs. So just comment generally on some of the drugs that seem to be promising.
Well, you know, it looks like remdesivir has gotten a green light because it may have some benefit. So I'm not thinking that there are any drugs locally right now that are any magic bullet. But it wouldn't surprise me if, you know, within a year we have antivirals that are much more effective. Umair, I don't see anything on the market right now that is.
And even that antiviral remdesivir that you're talking about is really not, it's not going to get rid of it, or it's all it's going to do is shorten the illness from it. Yeah.
Any updates on the Houston and Harris County statistics?
Well, we report new numbers every day.
That's right. It's on the dashboard, and you know, I will say that we've had about 150 or so deaths, unfortunately, in our community. That is still quite low compared to, for example, I know LA County had crossed the 1,000 threshold. So, you know, there are we've as a community made a lot of great progress.
Ending Saturday Night Live, Umair. Who's going to play you?
You know, I like the
30 seconds.
I like the. I like the guy on the news,
Colin Jost?
Colin Jost? Yeah, that's why I would say.
Okay. You know, I really appreciate your
What
opportunity.
about David?
No. The question was for you, not for David.
Colin Jost.
Next time. And besides, I've actually gotten through all of the questions. I want to thank you for joining us for our COVID-19 talk with our local health authorities. David Persse, representing the city of Houston, Umair Shah, representing Harris County. Thank you to the Rotary Club of Houston and President Kathy Finninger. My name is Stephen Williams, Director, Houston Health Department. See you next week.